Hey y'all, welcome to the Skintrovert. I'm your host, Sam Bazile. I have a special treat for you guys because you are about to meet Tina Torres. She is a nurse injector from Texas, an incredible, talented injector. She's also an instructor, and she has a very unique way of educating providers. And I wanted to invite her in on a topic that I feel is plaguing the industry right now, and it is why the tox ain't toxin. So let's meet Tina and see what she has to say. Welcome, Tina. Hey, y'all. So I am super excited to have Tina on with us today. She is incredible. And if you guys don't follow her, you need to go follow her. She's got adventures with Tina. She's always somewhere doing something, educating, doing something with aesthetics, and she is phenomenal. And I wanted to invite her on today because there is a topic that I think is plaguing this industry right now, and that is tox resistance. And she is an incredible educator, has so much to say. So before we dive in, Tina, do you want to tell us a little bit about yourself?
Yes. Hello. Good morning. Happy Monday. It's a new week. My name is Tina. I'm in Fort Worth, Texas. If you don't know where that is, it's right next to Dallas. I'm excited to, I feel like Sam and I have been like internet friends, like fangirl. When I'm happy to be here. I'm just happy to be here.
And look, I feel the
Yes.
same about you. The same about you. It is the feeling is mutual. Okay, so let's talk a little bit about tox resistance. So, when a provider tells a patient that they are resistant to tox, what does that mean?
Okay, so when a provider tells a patient that they're resistant to tox, that means that their muscles are not responding or having the desired outcome that should happen when we put this muscle relaxer in your muscle. So when someone is resistant to it, either they aren't responding as well as they used to. Maybe before they were icy, and now it requires, or little by little, there's been a dose creep where you've had to get more and more and more to a point where, like, I would have people sitting in my chair and they're like, I don't know if I can keep spending this amount of money or if
Mm,
it's worth it, if it's not working on me. So, tox resistance, ineffective outcomes.
makes sense.
Yes.
So, is this common though? And why do you think now all of a sudden we're hearing so much more about it, whereas before it really wasn't talked about?
Yes. Okay. So I feel like we're hearing more about it now than we did before because it takes repeated exposure to some of the different branded toxins. And now that, like, when did Botox got FDA approved? I think in 2002, cosmetically. So now we have people who have been getting Botox or Dysport for 2 decades. So they
Hmm.
have been exposed to a neurotoxin for this prolonged period of time. So maybe initially, when Botox was first being utilized, we didn't see any of that resistance, or it wasn't as like um, providers maybe weren't as aware or observant to it before. And so adding a couple units each time they came in just felt like, oh, this is just where we're at right now, versus now, two decades in, and we have several different options of toxin, which there is a reason why I like to use the one that I carry. And it's just I explain it to my patients this way. When you get like a flu vaccine, we get the flu vaccine to protect ourselves from reaping the rewards of acquiring the flu. So when our body is exposed to that vaccine, our body has an immune response and builds antibodies to that to be prepared for when we actually encounter that. And so with neurotoxins, there are, I have my little
Oh, I
3D
love
model.
it.
I am very visual. So, like, this is what a neurotoxin, um, I guess, example of how they look. This is the most important piece, the
Okay.
actual protein that we're injecting. This is the part that relaxes the muscle. And then there are accessories attached to that toxin. So, like with brands like, and I'm not calling anyone's baby ugly, I'm just talking about the science
I
of
get
it.
it. I get
But
it. Safe place here. Safe
so,
place.
Yes. Okay. So like brands like Botox or Dysport, which have been around the longest, those are the titans, right? They have these additional accessory proteins that don't serve a purpose. The purpose that they serve is to stabilize the molecule and help. If this was like orally ingested, this would protect us from this.
Got
When
it.
it's injected, this serves no purpose. So it is useless, basically. With these accessory proteins, though, when we're exposed to it and we put it in our body, potentially, and this is it's pretty rare, but if you're the one that it happens to, it's not rare. And before, I used to be able to say, like early on in my career, that I never encountered anyone who didn't have an outcome from it. And then I had my first one and I didn't believe it. I was like, no, it's going to be me. It's going to work, but just wait, just wait. We tried all of them and I had to be the bearer of bad news to deliver, like, hey, I don't have a solution for you, and I don't even have anyone I can like recommend you to, because at that point you're gonna have to take a break to get rid of those antibodies and be able to respond to it again. So to answer your question, why is it so popular now? Now Botox is it's people have been getting it for more than just frown lines and forehead and crow's. Now like we're if you were, I used to be in pediatrics and I had some pediatric kiddos who had to get Botox, like large doses of it. If they
Hmm.
were getting like Botox therapeutic at the time and they'd be getting loaded with this dose, like that's going to be a bummer if in like 20 years that is ineffective for them and it's for therapeutic purposes. So Xeomin is my toxin of choice because
Hmm.
Xeomin is one of the only toxins that is just the important piece,
Oh,
just the
wow.
muscle relaxer, just the protein. So, like, I say it's probably like the most organic, if it could be, even though we're putting it in our face. But of all of them, it just has everything. It's like filtered water. We're putting it in,
Okay.
it's purified, so the chances of that non-response are less. And only about 1.8% of people, there's a white paper out there that says 1.8% of people are non-responsive to Xeomin. So that small window, I would rather use Xeomin, and because like I'm planning to get Botox till my wheels fall off. Like
Same,
until
sis.
you tell me it's not working. Like I get it for like my masseters, like for other things that are just not related to aesthetics. And I don't want to be the person who delivers that news again, because now I have, and it's come up more and more. Um Sometimes it's not always resistance. Sometimes I explain it to patients too, when I am allergic to everything in the air. Pollen, trees, cedar, all the things. And I will use Claritin for a little bit, and then I will switch to Zyrtec or Zysol once one stops being effective. So sometimes with toxins too, it could be that we might just need to switch it up. But we don't know until you're sitting here, and when you're the person sitting in the chair and it's inconvenient, it's not fun. So yeah.
Okay, so I'm liking this. So it might not always be resistance. There could be other things at play. And then providers can switch up the neurotoxin to try to help. You may or may not be able to answer this, but is there anything else that providers can do to help prevent the risk of developing that resistance? Like, is there something else a provider can do to be a little bit more careful or preventative?
hmm So if a patient comes in and they get neurotoxin treatments therapeutically and cosmetically, like let's say someone gets it for migraines and they don't get it here, they go somewhere else, it would benefit them or their provider to educate them. Like it would be wise to try to plan them on the same day so that your exposure is just like at one time instead of this time. And then in 3 weeks, you're like, oh, by the way, I'm due for this. And
Mm.
so that's why, like, when providers say, like, don't come in sooner than 3 months, there's a reason so
Oh,
that
wow.
we're looking out for like future you. Like, yes, you got to live with lines for a few extra weeks because
Hmm.
I metabolize it fast. After 6 weeks, I don't have my lines back, but that movement starts to come back. And some people think movement is bad, and it's just that muscle waking up. So, like, waiting the full 3 months, holding out, planning your treatments. Zinc is also a supplement that is helpful to take when you are getting your injections. So sometimes I'll have clients start taking it before they come in. Just having that in your system when you get your neurotoxin can prolong your results. I think if the paper says like 30 up to 30%, I know it comes around to like 3 weeks. So little things that just being mindful of timing, when people come in, making sure your body is ready to, like, if soil, I don't know a lot about farming, but I know they have to like plow to
Hmm.
prepare to put the seeds. And so it's wise to also have clients like prepare, like if they're on Ozempic and
Yep.
they aren't getting protein. Protein is an important piece to your muscles. Like,
Ah,
you eating like a bird is not helpful. Like, it
wow.
can affect like your outcomes. And so sometimes when people, it's great that they're like losing weight, but then there's another piece of like, you're not eating, you're not getting enough protein, you're not feeding your body the things that it needs to like function and receive, just like Zeo, right? We have to
Mhm.
condition the skin before we can do other things.
That's
There
right.
are things that people can do to condition their body. Like, it's not just us. And I know you know this with skin, it is collaborative. And
Yeah.
this drop of toxin can only do so much. This is a dentist visit. You have to brush your teeth every day at home and do your part.
It's wild how people, and I can't say it's their fault. I mean, I guess if I wasn't in this world and I wasn't educated the way that I am, it would be easy for me to like live in the dark. But I feel like sometimes when I try to have that conversation,
Yeah.
that skincare is such a vital part of this. I'm thought like, oh, she's just trying to sell me all the things. She just wants me to buy the things. But really
Yeah.
and truly, like, I always use the example of like an alligator, right? Like, I could take thousands of dollars worth of Botox and filler and inject a crocodile, but at the end of the day, you're just kind of a fat, happy crocodile with crocodile skin. Like, if you want your skin to look its best, to be as healthy as it possibly can, get the
Yes.
injections, do what you got to do, but you also need to take care of your skin. The quality and the health of the skin is going to determine, in my opinion, how long that tox is going to last and how good it is going to look. Do you agree?
100%. And like, when I first started injecting, I was very ignorant to skin. Nursing school, we go over skin, but not like y'all do. And like, in your world, I don't know skin. I didn't know skin on that level. I remember my rep at the time too, Courtney, my Zeo rep. She was like, okay, here's the plethora of things we have. And I was like, oh my gosh, like, I don't like to recommend something if I don't know enough about it. Like, if you're going to have a question, I would like to 9 times out of 10 have the answer,
And I love
and
you for that. Yes.
yeah, it's like it's a disservice to talk about something. Well, people work hard for the money, and I don't want to take someone's money if I'm not giving them an appropriate recommendation. So if I'm not educated enough, that's why, like, okay, sidetrack. That's why I love Zio and how much education they provided. I would
Yeah.
not know, like, I didn't go to esthetician school, I didn't go to cosmetology school. I wouldn't know as much as I do now if it wasn't for like my rep and the trainings and the certifications and how in depth they are. So like, that is, if we're building a house, that is the foundation. We can't hang
Yes.
things on the wall if you don't have a good foundation. And so like, sometimes I have people come in for like injectables consult, and I'm always like, I am going to probably slightly disappoint you because the suggestion I have is not going to be immediate. We need to go to boot camp. We need to put our skin through boot camp so that I compare it to and I explain it to them this way. My husband, I see him every day. I can tell when he doesn't feel good, whether it's a cough, whether it's a runny nose, whether his eyes are red. And our skin is the same way. When it's not healthy and when it's not taken care of, we know that the things we see on the surface are signs that it's like, help me, you know?
Right.
And so, someone who's healthy, they're going to be more resilient. They're going to be stronger. They're going to bounce back quicker when something knocks them down. And our skin is the same way. And I think it's I mean, I didn't learn about skincare growing up. Like, my parents did not emphasize that. We didn't have like the budget for it. So, like, there's a lot of, I don't think it's like people's fault for not knowing because there's
That's right.
also an overwhelming amount of information out there. But I preach skincare, like, and it's not, and I tell people I'm not trying to sell you this. This is long term. I want you to need me less in the future. Like, if I
That's
can
right.
help you get your skin happy enough, you'll be surprised with how many of the concerns that you see might help itself. And you are maintaining your house. I'm just here to like interior decorate after that.
Man,
Yeah.
that should be like seriously, that should be the motive of every single injector out there. Like, and I feel like if more injectors were on board or more aesthetics providers were on board with that approach, I feel like this industry could really take a much better turn. And I feel like we're there. You know, I was talking
Yes.
about this
Yes.
with another provider on here, and I'm hearing more this word longevity. And I love that because that's not something that was even a thought when I first got into aesthetics. It was more filler, more Botox, more filler, more Botox. And we weren't really thinking about the actual health of the skin and the longevity of the skin. And now I'm starting to notice more people kind of taking that shift. So thank God we're getting in a much better space with it. But okay, so I'm so glad we brought that up because that's not something that I think patients always understand. And when a provider brings it
Yes.
up, they're misunderstanding the motive. They're thinking it's just, oh my God, she wants me to buy all these things. And because, right,
Yeah.
everybody wants that fast, result. They
Instant.
want instant
Yes.
gratification. But you have to think about the skin. It's an organ. It's your largest organ of the body. And when your organs are unhealthy, is there anything that's gonna get you healthy like
No,
that? No, it's diet, it's a lifestyle change, it's probably some kind of supplements, medications, you need guidance from a provider. It's all the things that your
all
skin
of it.
needs. And we want to skip
Yes.
that and just say, well, just inject it. It'll fix it, just inject it. But
Yeah.
that's not what's happening. And you brought up, and I wanted to ask this because this was not anything I've heard, but recently, I've been hearing a lot of, oh, you're on a GLP-1, that's why your tox is not working. And we just leave it at that. And we're not really explaining it. And you did touch on it. You said that when you're on these medications, you're not getting the proper amount of protein, which is probably why your hair is falling out and all these other things. So is that the reason that we're seeing this the way that we are? It's just like nutrition, maybe?
I would say so, like, you're gonna have people who have been and this isn't like my specialty, so there's probably
Yeah,
someone smarter
fair.
than me who will have more information. But with GLP-1s being as accessible as they are now, when they weren't just, I would say, like 3 or 4 years ago, you have people who were receiving treatments prior to that. Okay. And they were this age at that time. And so this is their baseline knowledge of how their body responds to toxin, how it looks, how it feels, how long it lasts. I think what patients forget, so not just to like blame like malnutrition, but like I
There's
think
more,
patients
Sam.
forget, yeah, like they have aged since they started that medication. Time doesn't stop when we get Botox, it hits pause on it. And so, and if someone has this expectation, this is how long it lasts, this is how it looks, and then also their face changes, they lose volume and support in places that
So
they
true.
didn't pay attention to before. So, the structures of their house, someone came in with a sledgehammer and started knocking things down, and now their body might not respond to it as well as they would like. So sometimes I think it's also expectations. Like I mean, I lost 100 pounds on a GLP-1 and I
That's
looked
awesome.
like 10 years older. It was good. Like health wise, I was great. I didn't have to take my diabetic medication anymore. I got off my blood pressure medication. I could walk up a flight of stairs and not be out of breath. But like face wise, like we age every day that we exist. Every day I tell patients like collagen, elastin, proteoglycans, we are born with a limited gas tank of those things. And that's just a small group of things that our skin needs to thrive. Every day that we exist, we're going through our gas tank. And so while people are on GLP-1s too, time is passing, they are aging, the structure and health of their skin is changing. If they're not already on skincare, it's a whole like
It's a lot.
domino of like, yes. So, but if to help themselves, not I don't want to say people are starving on the medication, but like I was on it. I remember
I
not
get it.
thinking about food. Like
Mhm.
it's not something that just takes up space in your head. So it's hard to eat also when you get full fast and food doesn't
Yeah.
taste as good as it used to,
Not as
you
yummy as it
know?
was.
Yeah, yeah. So I there's I think it's important to, as a patient, to go to a provider who doesn't just lean on the knowledge that they have,
Mm,
because they will only be able to guide you with as much information as they have. And
true.
so, something for patients to pay attention to, like if you have your ride or die injector, esthetician, provider, that's great. They can only take you as far as they've gotten. And so I think
Mhm.
something, if I could give a piece of advice to patients or clients, is to go to someone that you see being uncomfortable, being comfortable, that
Mm,
is continuing to educate themselves. Like, I mean, I'm impressed with, I go to train with one person I've decided I'm going to go every year. And I was like, what could I learn this second year? And there's just new research, new articles, new
right.
information. My husband was just telling me he loves Zio and he listens to podcasts. And he was like, there's a new SPF that's coming from around the world, and it is different from anything that is available in the market. Are you familiar with it? Do you know
I
what I'm
love
about?
it.
Okay.
Yes.
Okay. I don't know a lot about it. He was like, it would be wise for Zio to get on top of that, to like be, he was like, that way they can differentiate. I was like, honey, they just got tinted SPF. Like, we got to give
Calm
it
down.
time. Like,
Pump the
I'm sure
brakes.
that, yes. I was like, I'm sure they will. But,
Well,
but
listen, I will say that is one thing about Zio in comparison to other skincare lines. I feel like in this again, this is not me calling anybody's baby ugly. I'm just speaking from my
yes.
experience with Zio. I feel like Zio manages to stay on like the cusp of like what is new and what is innovative in the industry without giving in to fads or like trends. Like, for
Yes.
example, I spoke to one of the product developers and I was like, so, because I was saying all the things that are in the market right now. I was like, oh, there's
Yeah.
this and there's that. And he's like, it's a fad. And I was like, okay, maybe so, but like everybody's jumping on. He goes, but it doesn't matter. He's like, if we jumped on every single trend or fad, we would just be like the next, like Metacube or something like that, which is fine. But you have to figure Zio is not really here to be trendy. We're here to
Hmm.
change the health of skin. And that is the goal. So really yeah, right. Bringing on anything that's like just a trend or a fad is not really what Zio is looking for. Now, that's not to say that years might pass and we find out that this random ingredient is transformative to the skin, then I can almost guarantee it will be brought in by Zio. So you
Yeah.
can hold me
The
to
fact
that,
that
but
they update their formulas, the new growth factor. I couldn't
that's
use
right.
it before because I'm susceptible to milia.
Mm-hmm.
And so like but I was just like, of course they changed it. Of course, like, and every year, every time, what is it, in September, there's always a new launch, a new
Something
release.
out.
And I treat it like the iPhone. Like whenever they're, like that day, like I block off the day and my husband's name is Greg, and he'd be like, why are you wait, you're off today? I'm like, I gotta know what's coming.
We have
Are
to
you
be aware.
kidding me? Yes. Like
I love
this has
it.
been in the making.
I
I
love
know
it.
like it comes year to year, but I know it's probably beyond that, like it's the
Well, you got to
iceberg,
figure
but
you've got all the clinicals that are involved in it. It's not like just rolling out a product, it's the testing, it's the trials. And then on top of that, you have to educate because you know that our Zio has an education team. So it's like they have to be educated, they have to be fluent on it. So yeah,
yes.
it's like a whole Lots going on behind the scenes, but okay, to like bring in the product side, like the skincare side of this conversation. So
Yes.
I was working with this group of estheticians, and this one esthetician in particular was so excited to show me these pictures. And when I got there, she's like, I couldn't wait for you to get here. I had to show you these pictures. So she pulls up her pictures, and just to tell you what the reference is, and I'm sure you probably have your hands on it too, but the peptide serum from Zio,
Oh, yeah.
she was like, okay, look, I have held off on my injections because this is an expensive product and I wanted to see what it actually can do without influence from injectables or anything else. And she was
Mm-hmm.
just over the moon because at that point it had been 6 months since she gotten her tox injections. And she's like, you don't understand. Like, I'm 3 months on the daughter. And look, she's like, I still don't even have movement. She's like, Sam, this is wild. This is nuts. So, if you are a patient listening to this, I would definitely say when you go to see your injector and they are sharing treatment plans that are going to help you get to your goal, don't look at it as, oh, she just wants me to spend all this money, because really that's not it. A great injector wants your skin to be healthy, and that is such an important part of it. When you are incorporating skincare products and not just any skincare products, like skincare products that
Mm-hmm.
actually work, they are going to help with the quality and the health of the tissue. When the tissue is healthy, you are maybe the movement will still be there, but it's not going to be
Mm-hmm.
as noticeable as it once was when the skin is dehydrated or unhealthy. It's just trust your injector. If you're going to someone and you're allowing them to literally put needles of toxin into your face, then you need to trust their actual guidance. They know what they're talking about, and skincare should always be a part of that plan for sure.
I agree. I agree. I did not see the value of it initially when I started injecting again because I was ignorant to it, but like
Yeah, fair.
it makes, oh gosh, all of the difference. And people are happier with their skin enough. Like our skin is our armor. That is the first thing we see when we look in the mirror. We know that's the first thing that people see when we walk into places. And I always tell people, like, you'll be surprised how much more confident you feel when your skin is happy, even if you don't have filler or Botox. And so that's kind of when people come in for a consult, that's where I start them. I'm like, all right, we need to get
We
your
got it. We've
skin
got to
up to
reverse this. We
date.
got to get this
Yes.
together. I
Yes. And
love
then
that.
also like educating them, like if you're like in your 40s and you are just now starting your skincare journey, you're not too late. However, 40 years of aging
That's
without
right.
the proper skincare that your skin specifically needs is going to take time to rebuild.
That's right.
So it's
That's right.
just, I think setting expectations and educating. Like I think it's when we go to if we go to the doctor for a cough, they're not just going to listen to our lungs. They're going to listen to our heart. They're going to check our ears. They're going to check our throat. And I feel like it's the same thing with our skin. When you come in for a Botox consult, we're going to not just talk about just the Botox in your frown lines. I'm going to listen. I'm going to look in your ear. I'm going to look in your mouth, which means the equivalent. We're going to talk about skincare and the things that add up to you being you. And
Yes,
I
I love
think
that.
uh, right now, especially with like TikTok's a great source for different things depending.
Entertainment.
There's
Entertainment,
so much
Michael.
information out there, yes, and there are
I know.
products that are supposed to be like solves this concern, but that's a band-aid. I try to tell people, I'm like, okay, if you're feeling spicy, someone upsets you and they tell you you need to calm down, what do? I'm gonna have a fit. You say
Mhm.
something, I'm gonna have a fucking fit. Okay, if you tell
Get
me
it.
to calm down.
Uh-huh.
And like, why is our skin any different when you have zits and you're over here throwing this product off a TikTok shop onto your skin and you're like, it's even worse. Like your skin's like, no, do not tell me to calm down. I need more than that. I need
That's
you to
right.
hear me. Yes, our skin talks to us, and if you can't read the language that they're speaking, you got to go to a translator,
That's
i.e.,
right.
us.
I love
Yes.
that. What a great
Yeah.
way to put that. That is so true. I love that.
I talk in
Okay.
pictures. Yes.
So look, I'm the same way. That's why podcasts has been so difficult for me because I'm a visual learner and I find that I'm also a visual educator. And so when
Yes.
I want to talk about something, I want to use my hands. I want to make a little, yes, see, okay,
I
you get
have
it.
so many things.
Girl,
Yes.
that has I think that's probably been the hardest thing for me with doing podcasts because it's like I realized that there's some people that are not they're not seeing, they're just listening and I'm like, "Oh shoot, I'm realizing you can't see my hand movements or you're not, it's been
Yeah.
the hardest thing." So look, I get it. Okay, so obviously you and I share a common bond with skincare. We have our faves, but talk to me a little bit about your favorite toxin and why. I think you've already mentioned it on here, but is there
Yes.
one for you? Because there's lots. Okay, so if you want to kind of give
Yes.
a little overview of what's in your menu of options, and then what's your go-to and why.
Okay. So Xeomin is my go-to toxin purely for the science of it and the toxin resistance that can happen. And again, it's a very, very low percentage, but it's low until you're the person that it happens to. And
Mhm.
I always happen to be the person that things happen to. And then also, you don't want to like people who are religious with their treatments don't want to wait 1 to 2 years.
Right.
Like that's a I don't know if I'm allowed to cuss. That's a mind fuck for some people because they're
Yeah, it's
just like,
hard.
what? Um, so Xeomin is always my primary. I start everyone on that. I don't charge per unit for the different brands. It's all I charge per outcome. You want
Oh, wow.
to address your front. That way, there's no like picking and choosing with units. I am going to assess your muscle. This
Mm,
is the outcome that you booked. We're going to do what it takes to get you that outcome. And then I have them
love
in
that.
like different steps. So the outcomes, they're like kind of different doses too, but it gives me more freedom to dictate what the best treatment plan is. And then that way the numbers and units aren't a stress level. So Xeomin is my primary because of the protein portion,
Hmm.
it just having just the necessary protein to relax that muscle. These are not attached to it. If I inject you, I am decreasing the chances of you having resistance if we're using this. And I will say Xeomin is softer than other neuromodulators like Dysport and
Hmm.
Botox. They
Yeah.
slap. They're good. They hit every time, right?
Hmm.
When you're used to again, the expectation, this is what I'm used to. Xeomin will relax those muscles. Those lines won't be there, but it's not as intense. And I like that because my goal for patients when they walk through my door, like I want them to walk out of here and they still look like themselves. I want them to walk out of here and no one can pinpoint that they've had things done or they're surprised when they've had things done. Um, I always say like the best injectable is undetectable. And
Yes.
so my husband, when we're depending where we're at, we're walking, and he's like, "Oh, that person has filler." And I'm like, "Yes, honey." He's like, "That means that's no good." And I'm like, "That's
That's right.
right." So like Xeomin's my favorite. It's soft, it's natural, it's better long term for longevity. Again, I'm planning to do this for as long as I can.
Right.
Secondary, if Xeomin doesn't work for someone, again, I have people now who have been getting treatments for a prolonged period. So their muscle might not respond as well to Xeomin
Mm,
because, in comparison to their other treatments, it's not as like robust. Still
I
effective,
see.
not as robust. So my secondary is Daxify.
Okay.
Daxify is like it's peptide powered. We love our peptides. And so it helps kind of prolong, it's supposed to help prolong the longevity of the outcome. I remember before when it first launched a couple years ago, they said that it lasts 6 to 9 months. Um, it's
Yeah.
okay. Like I did have like I'll tell you once it came out, like I did try it on some people. It lasted longer than normal, but at the end of the day, no matter what brand, they are all muscle relaxers. They all
Mhm.
just do it a little differently. I think of it like, and I try to put it to patients this way because I have some people who come in and they're set on like a certain brand. But if I have a headache, I need to take 800 milligrams of ibuprofen. If my
Mhm.
husband has a headache, he can take a baby aspirin, 81 milligrams, and it's fine. We're two different people. The pain reliever that works for him is different for what works for me. And so I don't learn that until after I've treated someone. So
Mm.
Xeomin first. If they respond, that's going to be our drug of choice. If not, next step up, hot big sister is going to be Daxify.
Okay.
Okay. Responsible oldest sister is Xeomin.
I like it. Okay. All right.
Mm-hmm. Mm-hmm.
Okay. All right. So we learned a lot today. I'm loving all of this new information. Hopefully, it was helpful for some others that maybe think they might be going through resistance, or maybe they just realize they need to try something new. I do have some rapid fire questions. I love to end that with some of my guests. So here we go.
Okay.
First toxin you ever injected?
Botox.
I figured it was going to be
Botox.
Botox. I feel like that's
Yeah.
usually what everybody
Allergan.
first starts playing with. Yep.
The Kardashians were all about Juvederm and Allergan at the time when I started. Yeah, people specifically, they're like, the Kardashians get Juvederm. That's the filler that I want in my
Oh,
lips, you know? Like, it's like go to
it
the
was so
doctors and
wild.
asking. Yes, but okay, so Botox,
All right. Okay. What do you think is the most underrated treatment area for tox?
the most underrated.
Mm-hmm.
Okay, our DAOs, our
Okay.
depressor angularis oris. And if I can give you a picture, okay, because people are going to be listening online. Think of
See
the
how hard it
corner of,
is? See?
yes, yes, you're right. Okay, at the corner of our mouth on
Mm-hmm.
both sides. So the top of the triangle, picture a triangle, okay? The tip of that triangle is at the corner of your mouth. Now draw that triangle,
Okay.
okay? Both sides of our mouth, like a puppet, we have a muscle that pulls the corners of our mouth down. So we
Mm-hmm.
can make a sad face. Maybe you're about to step in dog poop and you're like, ah. Maybe you're carrying all the groceries in one trip and you're like, ah. Like we're making this face and we don't even realize it. And like hitting this muscle, it doesn't take very many units. It's like 3 to 6, maybe, just to sprinkle, right? When we relax this muscle, if its job is to pull the
Mm-hmm.
corners of our mouth down. When we put Botox in that muscle, it does the opposite of its job. So instead of pulling down, it relaxes up. And so it kind of turns like the corners of your mouth up. If you have like
Nice.
shadowing around the corners of your mouth, you don't want filler. It's a nice, like little push up bra for the corners of your mouth. And it's also preventative. Because we will get those little lines, it contributes to jowls. I mean, because the skin laxity, it does not bounce
Yeah.
back and recoil to its resting position. So it sits here. So I think it's underrated. People focus on the upper half of their face, but our lower face is still aging.
All right. So I'm going to ask this. This is not a rapid fire question, but because you
Okay.
said that area, I'm going to ask. So years back, it's probably been like 4 or 5 years ago, I got Botox in my chin, and it might have been
Okay.
Dysport. It was one of the toxins. Got it in my chin, because she said I had like orange peel chin. So we did
Okay.
it. I don't, and to be fair, I don't remember exactly where she injected it, but about a week later, it looked like, no, I didn't have anything weird like that. It looked like my chin was birthing a kidney bean. Like this middle part protruded and it looked like a kidney bean, and it was the strangest looking thing. And I remember going back in and I was like, is this normal? And she kind of giggled and she's like, well, okay, so she said it had something to do with injecting the chin but not the DAO area, maybe I'm saying this correctly. And
Hmm.
so it was causing this muscle to like do more of something. And the reason why I'm bringing this up is when you inject the areas that you're talking about, the DAOs on
Yes.
the side,
Yes.
do you also have to treat other areas as well? Or is that an area where you could say, okay, one and done? Like, or is it connected to something else and you got to do more?
DAO by itself, okay. Chin by itself is meh. It works better because these two, okay, I described the DAOs, right?
Mm-hmm.
Our mentalis, our chin muscle. I want you to picture your two fingers, your pointer and your middle finger, side
Mm-hmm.
by side, midline, right
Mm-hmm.
underneath your chin. Okay. You're looking at what the muscle looks like here. Okay.
Okay.
Its only job is to push your bottom lip up. So you can do this. Okay.
Okay.
Or when you make a
Mm.
sad face, you use both exactly. If you look at your
Mm.
face when you do that, you can see your chin and you can see your DAOs pulling. So it's like this.
There we go.
Like, okay. So
Mm-hmm.
it is the best, not best. It is better if you treat both. Can you do
Okay.
DAO by itself? Yes. If you're doing chin, I wish I could see what your chin would have looked like because
I'm gonna
just
send
out
you a
of
picture. I have a
curiosity.
picture of it. It was
Okay.
the weirdest thing. But that's, look, you're so right about that, how we're always focusing on the top half of our face and not the bottom. And you start to see that. Like when I even see it when I look in the mirror, I'm like, okay, I can get this upper half of my skin looking phenomenal, but then this is still not as tight or it's saggy or there's like lax issues. And I want to do more, but the kidney bean birth was a little
Yeah.
traumatic. So now I'm like scared to do it again.
Yeah. You should
But
try
yeah, we'll have
it
to revisit.
just DAO, just so
Okay.
you can see. You tried chin by itself, try DAO by itself, and then pair them together.
Okay.
Yeah, yes.
I like it.
DAOs. Don't
I like
sleep
it.
on it.
Okay. Maybe you might know this, maybe you don't, but rapid fire question. What is the
Mhm.
biggest myth about Botox? And I guess that could be just talks in general. What do you think people struggle with that?
Um, I'll say two things. It's 50-50. One, you're gonna look frozen and done. Like
Oh yeah.
people picture like Jennifer Coolidge, like not ideal. Have you seen Christmas with the Cranks?
Yes.
Do you
That's
remember
my
that?
husband's
Okay,
favorite movie. That's his
you
favorite movie.
remember when he got Botox and they're eating, he was like, I'm fine. And like all the water is
All the
falling.
food was
Like
coming out and his eyes were like way up here.
that is
Yes.
what people picture, which by the way, at that time, like if he was getting Botox, it was not researched or explored like techniques. Like there was a one size fits all. So like that is probably appropriate for then. Things have advanced to now. So
Yes.
one would be you're gonna look like that. That's the image people have in their head. And two, if you start getting it, you can't stop because then you're gonna look old. And I wanna like flick that because again,
Yes.
if you get it, you've had it for 10 years, you've always had it for those 10 years, and then you stop. 10 years went by, your skin is different. Its structures
Mm,
underneath the surface are different. You cannot just solely like it's not just Botox. So the myth and like the maintenance, people are afraid of that's okay, that's the third thing, the maintenance of it. Listen, my change oil light comes on. It came on 2 months ago. Have I changed it? Not yet. Like, so we prioritize the things that we want to maintain. And if the timing, I tell patients too, like, they're like, how often should I come back? I'm like, you know where to find me
there you
when you
go.
feel crusty. Like I don't even like to give time frames because like as long as you feel good, you feel cute. I don't want to tell you 3 months and then you're here at 3 months.
You feel
You
like you
still feel
gotta
cute
come.
and you
Yeah.
still look good. Yeah, like and I know because if you've had your toxin done, like when it's worn off. Something's off. Like you're all of a sudden you're like, have I been ugly this whole time? Oh no, I mean both sides. You know what I mean? Yeah. So
You know
how you'll look.
yeah, the terminology that I tell her, I'm like, I'm getting meaty because you know what that is. Like you're not tight anymore. Like all of your forehead is
Yes.
starting to look like
Yes.
meaty again.
Yes. So those would be like the three myths. You're not going to look fake. You're not going to look older from getting Botox if you
Mm,
stop getting it. And the maintenance is completely dependent on you. And the difference with coming to see me, I don't know other places, but I'm not going to shame you for coming in once a year for trying to do something nice for yourself. If you can only make it here once a year, I'm going to help you feel better that annual appointment versus like someone who comes in every again comparison, don't compare to your friend who goes every 3 months. And
I love
so
that.
the maintenance is solely up to the person getting it.
Okay. I love that. Okay, last question.
Yes.
Someone who works out is going to burn through their Botox faster than someone that doesn't.
Okay. Yeah. Yeah. So quick answer, my like bodybuilders, my super active people, my fun in the sun folks, like
Mhm.
they do be eating through that, through that like they do metabolize. Like those are my people who cannot wait the 3 months. Like they're scheduling, and I check them too. If I canceled one of my clients' appointments and I pushed it, and she was like, "You noticed?" I'm like, "Yes, bitch, you're early. It's not time. Like I like you. I care about you. So like, don't come in sooner." Yeah, so they do, and that's a tough one. Those are my people. So I will say like Xeomin is not the best option for them because it is like a softer outcome. Those would be the people I would Daxify or Dysport if I carried that. Yeah.
Okay.
Yeah. No, that's you gotta
It's a
pick your
real thing.
poison.
That's it.
It is a real thing.
Well,
Yeah.
good thing I don't work out. So,
Yeah.
just
Yes.
kidding.
Not like that. No.
No, listen, I have so much respect for people who are gym life. I have so much respect for it because they're disciplined, they are structured, and that is probably the hardest thing for me. I am like the most unmotivated. Like if it's something that I like see skin health, things like in this
Oh
world,
yeah. I'm
that
in. Count me
motivates me. Like
there.
that gets me going. But
Yes.
I just can't. I want to. My husband's now on this gym kick, and he's doing all the things. Of course, he's looking
Hmm.
great. And he's like, you could come if you want. I'm like, yeah, no, but
Cool
I'll see you when you get
things.
back.
Yeah.
Like it's
Yeah.
just not, it's not my scene. I want it to be, but mad respect to everyone else who's out there who's winning at life. I will get there. I will
Yeah.
get there.
Yes.
Just not
Well,
there yet. Not yet.
it depends on how you define winning at life, though. So,
Oh,
yeah.
true. I have other
Yeah.
areas where I'm shining,
You do that.
That's
Yes.
right, my forehead, girl. Oh,
Exactly.
God. I love it.
Got a lighthouse beaming from my forehead.
That's right. Okay, Tina,
Oh,
thank you so much
Sam.
for joining me and being a part
Yes.
of the Skintrovert. You are an incredible person. You are such a light to this community, and we are all grateful to have you. And look, if people are not following you and they don't know where to find you, would you tell them a little bit about your Instagram handle, your social media, and then where you are practicing if they want to come see you?
Yes, if you are in Texas, I am in Fort Worth, just right outside of downtown, the little neighborhood I'm in is so cute. There's so many walkable places, little community. And my Instagram, if you're on Instagram, it is Tina Torres underscore cosmetics. If you are on TikTok, it is underscore just Tina Torres. Oh, no, just underscore Tina Torres.
Love it.
Yes.
Okay, well, y'all
Okay.
go follow, go check out Tina. She's always on some kind of adventure doing something. She's amazing. So, all right,
Thank
guys, thank
you.
y'all so much for tuning in. Until next time, bye,
Until
guys.
next time, toodaloo kangaroos.
Think of the Skintrovert as your aesthetics roundtable, not a training manual. This podcast is for professional education and discussion. It's not medical advice. Your scope of practice matters, regulations vary, and your license always leads. To continue the conversation, follow the Skintrovert on Apple, Spotify, or any platform that you listen to your podcasts.